Vitiligo is a disease that is relatively slow in its progress and does not usually become associated with itching at all. There, however, is a subset of vitiligo called inflammatory vitiligo, and this you'll find in individuals where the progression of the lesion is very rapid and there is an inflamed or reddened border around the lesion while it is advancing. Inflammation, as you know, generally is associated with itching. There's a lot of histamines that are released during an inflammatory process, and that is what induces the itching in the skin. And so individuals that have inflammatory vitiligo will experience mild itching, not severe at all. And so topical antihistamines or anti-itching ointments will help remedy that irritation. This is an easy question to answer. There is no association of alcohol and vitiligo in any way, shape, or form, whether it's rubbing alcohol, drinking alcohol, inhaling alcohol. That is not an inducer of vitiligo. On the other hand, hair colorants have been indeed associated with initiating vitiligo as well as perpetuating vitiligo. The reason for this is that there are chemicals within some of these hair colorants that are phenols and catechol that can cause contact vitiligo and have been known to. The reason for this is that these chemicals will make their way through the skin, into the pigment cell in the skin, and they're relatively cytotoxic to the melanocytes. And so if you have the genetic propensity to develop vitiligo, these chemicals will be very toxic to the sensitive melanocytes of the skin and cause vitiligo. Fortunately, most colorants now, after this revelation, have removed these catechols and phenols from the ingredients for hair color, so many of them are safe. There still are a few out there, though, with catechols and phenols in them. Just for men is one that I would be very concerned about using. So if you do have vitiligo and do want to color your hair, make sure you look at the ingredients that are listed on the packaging of these hair colorants, and if they don't have phenols or catechols in them, they should be relatively safe. Yes, vitiligo and tattoos have been implicated in being correlated. Okay, there's no direct scientific evidence that tattooing will cause vitiligo or potentiate your vitiligo, but in theory and anecdotally, it could. Tattooing is as I see it, a wounding process on the skin. Okay, you're putting needles through the skin, you're irritating the skin, breaking open the skin, so the skin has to heal itself after and during the tattooing. And when a healing process takes place, there are molecules that are released by the skin to heal it. And some of these molecules can influence the melanocyte to make more pigment and induce an oxidative stress in the melanocyte. And so one who has a genetic propensity for vitiligo could have their melanocytes damaged during tattooing. And so we have seen some cases of individuals who have received a tattoo and around the tattoo will develop vitiligo. So I really caution you not to have a tattoo if you have vitiligo. This is ironic because one of the therapies for vitiligo is tattooing to replace the color back in the amelanotic lesion of a vitiligo patient. But to do this, I would recommend having a dermatologist consult you. They will understand that tattooing is a therapy to be used only if you have stable vitiligo, you have not responded to any therapy, the vitiligo has been there for a long time, and then they will take the necessary precautions to make sure that the tattooing that they apply to the vitiligo lesion is safe and will not result in this consequential expansion of the vitiligo. There are no new treatments for vitiligo for the past, 5, 6, 7 years for adults or children. The current therapies that are used and especially successful on children are topical immunomodulators or immunosuppressants that can be applied when the vitiligo is first noticed, and frequently they will halt the progress of vitiligo and allow repigmentation to occur. These panel of immunoregulators and immunosuppressants are well known by dermatologists who treat vitiligo, and they're very safe to use. If vitiligo does not respond to this topical form of therapy, the dermatologist will then use what's called phototherapy or light therapy. And there is currently, as of the past 6 years, an excellent form of light therapy called narrow-band UVB. It is much safer than previous phototherapies. It does not include concurrent use of drugs or sorolins, and it is been fairly successful as an agent or a therapy that will allow repigmentation to occur in both children and adults, and many dermatologists' offices have the equipment to supply narrowband UVB treatment. Those are the best treatments we have currently until something else is discovered.